My name's Dr. Brian Newman. I'm the consultant surgeon who's developed this technique over the last 10 years throughout the United Kingdom and Europe. The treatment's going to show various methods of dealing with telangiectasia, both on the face and the legs. The first part is handling the needle holder, and it's very important that the tip of the needle is bent to 45 degrees, so the needle is always at 90 degrees to the skin surface. This video of nose veins shows the small veins being treated first of all on the side of this patient's nose. As you can see, we're going just subepidermal with the needle and starting with the very fine veins rather than the big veins. Some of these, of course, can only be seen under the polarized light which is being used here to visualize these veins. It's very important that you are entirely accurate running along the line of the vein. Now, when we come to a larger vein, you can see we start at the periphery and run along the length of the vein, slowly clearing it. Each incision is approximately 1 or 2 millimeters apart. It varies somewhat in different areas of the skin, depending on how much fat there is and how far the heat will travel out. This little angiomatous area, we start at the side, run round it, and then just hit it in the middle and it'll disappear. Now this large vein, again we start at the periphery, run along the vein and get to the larger part of the main surface of the vein. By starting at the periphery, we decrease the flow. At all times the needle must be absolutely clean. If the needle is not clean, you run the risk of causing some skin discoloration. You'll notice that as we're running along the vein, there's no smoke and very little in the way of bleeding. When you come to a large vein, it's important to start on either side of the vein, narrowing it down, and once it's narrowed, we then go through the center of the vein. This decreases any bleeding that you could get. Sometimes with a large vein you may need to go over it 4 to 6 weeks later. Most of these will be cleared, and you can see here immediately afterwards that the nose is completely clear under polarized light. A little bit of subepidermal edema and that will settle within an hour. And this is the before and after picture. Now, vein wave is also very useful for the treatment of nose veins and intranasal veins, and has probably become now the treatment of first choice for the treatment of nasal, perinasal and intranasal veins. On this patient, we're starting again with the veins on the top of the nose. It's always a good idea to deal with this first of all. I should make a point that we do not prep the skin prior to treatment. The temperature setting is 40 and 0.2 power on the machine, which is heating the tissue sufficiently to kill any superficial bacteria. In its use over the last 10 years, I have never seen an infection. It's important also, if possible, not to use any topical anesthesia, as this causes vasoconstriction. None of these veins that you're seeing treated on this video have been given any analgesia or anesthesia, and you can see as we go around the side of the nose, which is an area that is in fact a little tender, we generally don't have any serious discomfort. Intranasal veins occasionally cause a bit of reflex eye watering, and occasionally a patient may require a little bit of preoperative Brufen. can see also as the video proceeds, the needle remains completely clear. It's always held at 90 degrees to the skin surface, and the incision is just subepidermal. It's very important that there's no depth to the incision and there should be no tenting of the skin. If the needle needs to be cleaned, just clean it with a small piece of cotton wool. And here you can see the very tender intranasal veins being cleared. In my opinion, over the last 10 years, this has proved the best treatment for clearing this type of telangiectatic vessel. This shows the immediate after picture. There's no particular aftercare. The slight subepidermal edema and redness settles down, usually within an hour. The treatment is also very useful for small angiomas on the lip, and this shows one just being treated, and usually just one touch with the probe will clear the lesion. This is another example of the alar veins being cleared, and you can notice in this some degree of redness along the side of the nose, and these veins are always part of an inflammatory process, which generally we settle down using a mild topical acid preoperatively. It's very important because this prevents the veins from recurring if you can get rid of the inflammatory process. These veins are very fine, and as you can see, it's very important not to get any tenting of the skin and to only have a small amount of treatment pallor. If you go too deep with the probe, then postoperatively you'll obtain quite a considerable amount of microcrusting. Fortunately, there is no risk of any scarring. These are the little lip angiomas, and just one touch will clear it. This again shows some large veins around the side of the nose and a particularly large intranasal vein. Now, when we set the machine for treatment of nasal, perinasal and leg veins, the setting that's used is 40 and 0.2 on the machine. The needle size is always a K3, and we're using a K3 needle which is insulated. In exceptional circumstances of very severe nickel allergy, it is possible to use a gold needle. You must remember, however, that the gold needle is not insulated, and the attention to detail, particularly of the insertion of the needle at 90 degrees to the skin surface, is very important, so that no arcing occurs on the skin. In my experience, the majority of people, even with severe nickel allergy, can still be used with the nickel needle, because the amount of time that the current is going through the skin is only 0.2 of a second. So the risk of reaction is very, very small. If you want to increase the heat, which you may do in some very difficult veins or large veins, rather than turning the heat up on the machine, you can decrease the size of the needle and use a K2. At no time should a K6 needle ever be used. This video is actually showing the rate at which veins are cleared, and this is standard practice in my clinic at the present time. As you can see, these large veins are cleared really very swiftly. Again here, taking the side of the vein first, narrowing the lumen and then hitting it in the center. Years ago, veins like this were often treated with injection, and injections for veins like this on the face should never really be used. Diathermy has no place in the treatment of veins like this. Get a small hemorrhage, just hit it again and it'll stop, or put a small piece of gauze on it for a few minutes. Intranasal veins are, of course, very vascular. Clearance rate using this technique is in the order of 90% of the veins visible using polarized light. This technique's been particularly useful in eradicating spider nevi of all sizes, and spider nevi all over the body, and not only in adults but also for spider nevi in children. The technique's the same. We start at the periphery of the spider, run along the limbs, and then hit the central vein. This particular patient on this training video has got multiple spider nevi which have been caused by alcohol. Occasionally you get a little bit of subepidermal edema on the face lasting about an hour when you treat alcoholic spiders. There's a very nice example, starting at the side, hitting the center, and they just disappear. The recurrence rate with spider nevi, interestingly, is in the region of about 20%. This is usually due to the fact that they are fed from deep vessels which you can't identify using surface visualization. They nearly all go at a second attempt if you need to do them. If they do recur, they'll recur within about 4 to 6 weeks. And no attempt should be made to redo them for a few months to enable any revascularization to occur properly. Spider nevi can be treated on the face without any anesthesia, and even in children I don't use any analgesics. The youngest that I've treated is 5, and I think this is a reasonable age to treat children if you need to. This film shows quite clearly how quickly these can be treated and how minimal the tissue reaction is immediately after the treatment. Apart from mild pallor, there should be no other skin discoloration. There are some techniques which use electrocautery or the wrong settings for their machines, which do in fact cause skin burning. That has never ever been seen with Veinwave. This shows a little bit of subepidermal edema, and this settles down if you should get it within half an hour to an hour. Now, Veinwave can be used to treat the telangiectatic small blood vessels on the eyelid. This gives you some idea of how minimally invasive the treatment is and how little trauma there is in this very delicate area of the body. It's very important when treating this that you don't go past the line of the lacrimal duct. Again, the settings are the same that we use elsewhere on the face of 40 and 0.2. Now, this treatment here of telangiectasia on the legs, and these are typical telangiectatic vessels, and with these we always start again, as we do on the face, with the peripheral blood vessels to slow the flow down first of all, and then for veins that are a little bit bigger we leave those to the end, and some of these we would treat using Veinwave and some we would treat by sclerotherapy. The rule generally in the clinics and with the doctors that have been trained in the UK and in Europe is that Veinwave is exceptionally good for veins up to 0.3 of a millimetre in size, and for veins that are larger, in other words, if you can get a needle into the vein, we would treat it by sclerotherapy. Veinwave is always done prior to sclerotherapy, and by using that technique we decrease dramatically the incidence of matting. It's normal practice to wait 4 to 6 weeks after the Veinwave treatment before suggesting either a second Veinwave treatment or for injecting. Again, there's no preparation of the skin prior to this treatment and no particular aftercare. However, it's very important to tell patients what the appearance of the skin will be after the Veinwave treatment on the legs. Immediately afterwards, the vein disappears, as you can see here in the video. Within 10 or 15 minutes of starting the treatment, they develop some subepidermal edema, and the picture looks a little bit like a mosquito bite. And the mosquito bite look will last for about half an hour, then disappear. Then nothing is then visible for usually a couple of days. Then the area where the vein's been destroyed, so in this video we're destroying several centimeters of vein, the body absorbs the dead vein wall, and there is an inflammatory reaction which looks like either micro scratches or like a cat scratch. It's also darker than when the patient initially started. That picture will last for 4 to 6 weeks, but it always settles down. This shows the slight edema and the mosquito bite look immediately after the treatment. It's not necessary to put any cream on this. It doesn't hurt. Most patient sensation is maybe of a little bit of heat.